Pelvic organ prolapse is the biggest secret in women's health. Despite nearly 4,000 years of medical documentation, despite research indicating that an estimated 50% of women experience pelvic organ prolapse, despite the fact that childbirth and menopause are the leading causes of POP, this condition is still pretty much stuffed in the closet. That has got to change. Hi, I'm Sherrie Palm, the founder of the Association for Pelvic Organ Prolapse Support, coming to you today to share a few thoughts about how patient perception of this condition and how it's addressed and practitioner perception are a little bit different, and what we need to do to address those differences. My story is not much different than any other woman who has experienced pelvic organ prolapse's story is. It was pretty much discovery upon diagnosis. The early stage of my adulthood, I was diagnosed with MS. I was about 30, and I was informed I would be in a wheelchair and within a short time frame, and that just didn't really fit with my vision of my adult future. So I did all the digging I could get my hands on. I hit Dr. Google, I dug into research studies, I looked for articles to find answers to my situation, and the puzzle pieces slowly came together over a couple of years. And I've been very fortunate and very blessed that I live a pretty balanced life. From that point forward, I was extremely tuned into women's wellness, and I stayed on top of all of my routine standardized screenings for breasts, for pelvic examinations, for general wellness as well, and read everything I could get my hands on regarding women's health in general to stay ahead of the curve. Like most people, when I had to go to the bathroom, I didn't really give any conscious thought to it. I just responded to the urges I felt, and that's mostly what most of us do. You go into the bathroom, you drop your pants, you do what you have to do, you wipe, you pull up your pants, you wash your hands, and you get right back to work if you're an average busy person. And I noticed on this particular day that what felt like a lump down below had been there for about 3 months. And I thought, what's going on down there? And I should explore. So I got the handheld mirror out. And backdrop for that is women don't look at their lower body, their vaginal vulval area with a mirror. We just don't. We're taught from young on that it's private, it's personal, and that we really don't even need to explore that area. It's just like an indifferent kind of a mindset toward women's below the waist health. Well, I got that mirror out and I took a look to see what was going on down below and was quite surprised to see a walnut-sized lump coming out of my vagina. And I thought, that can't be good. It kind of looked like a tumor, what I assumed a tumor looked like. And I wasn't freaking out because I hadn't read much about vaginal tumors, certainly not anything bulging out of the vagina, during my prior years of health exploration. But I contacted my PCP by email, and she was a good friend of mine, and she said, well, come on over at the end of the day and I'll do a pelvic examination. Upon examination, she said quite matter-of-factly, you have pelvic organ prolapse. I'll fit you with a pessary. If you're not happy with that pessary, I will refer you to a good urogynecologist in our area, and you two can discuss surgery. I had no clue what she was talking about. I had never heard of any of those terms. So went back home, hit Dr. Google again to see what was going on, and discovered that pelvic organ prolapse had been diagnosed or documented for nearly 4,000 years. And that there were 5 types of POP, that there were 4 grades of severity, that the symptoms were all over the page, and many of those symptoms I had been experiencing for a long time. So moving forward, I knew that I had to do something else because, frankly, I went from this to this in a heartbeat. I was one ticked off chick. I couldn't believe that all the research I had done after the MS, I'd never run across anything about pelvic organ prolapse when it was so common. In 2007, when I was diagnosed, the stat for prevalence was 3.3 million women in the US, which I thought was insane. Now, we read in research on a regular basis, 50% of women are experiencing this condition. To the best of my knowledge, there's no standardized screening included within pelvic examinations. And if there is, patients aren't being told that they have POP. Either one of those scenarios is not acceptable. So it's just a short revisit on the prolapse side here. There's 5 types of prolapse again. There's a cystocele, which is your bladder. There's a rectocele, which is your rectum. Enterocele is your intestines. Uterine prolapse is the obvious. And vaginal vault prolapse occurs when they do a hysterectomy. And if they don't tack up the top of those vaginal walls, they will move right on down that vaginal canal, come outside the body. Symptoms are all over the page. It could be, well, the most prominent symptom is tissues bulging out of the vagina. Right behind that is urinary incontinence. And urinary incontinence manifests in many different ways in women with pelvic organ prolapse. It could be stress urinary incontinence. It could be urge urinary incontinence. It could be overactive bladder. It could be mixed urinary incontinence. Certainly, 2 types of stress urinary incontinence that are very bothersome to women are coital incontinence, urine incontinence during intimate activity, and fitness incontinence, which occurs in that athletic woman who is exercising. There's also chronic constipation, which is a woman's constant companion when she's got a rectocele. All day, every day, you're constipated. You'd give your firstborn male child to have one good poop. That comes with gas and bloating because that fecal matter is not escaping that colon area. You can also have fecal incontinence because that hernia of impacted stool that you can't get out of your body, you can't get out of your rectum, the poop's got to go somewhere. And so it becomes loose stool, which moves around that bulge and then causes that incontinence. There's also pain with intimacy, very bothersome to women, obviously, and a lack of sexual sensation can occur as well. If you're not having any sensation during intimacy, might as well be out in the kitchen doing the dishes. So as you can see, there's multiple symptoms involved here. The type of symptom women will experience will vary depending on the type of prolapse she has, type or types, because typically women have got 2 or 3 types of prolapse simultaneously. And because of this, you cannot just say this is going to happen or that's going to happen. Every woman's going to be a little bit unique in her dynamic. Quality of life impacts are all over the page as well. This is a physical, emotional, social, sexual, fitness, employment quality of life manifestation. POP impacts just about every waking moment of a woman's life in some way or another. Women are really informed of, much less effectively screened for pelvic organ prolapse ahead of the curve. There's no forewarning when you're pregnant that you might have pelvic organ prolapse after the fact. Women that have managed to not be diagnosed with pelvic organ prolapse, whether they have it or not, come into their menopausal years and they're not informed either, even though menopause is the second leading cause of POP. So basically, women that have got pelvic organ prolapse are either highly anxious or they're very angry. We usually see anxious the most. To be diagnosed with a condition that is involving this most intimate aspect of your body is very, very unsettling for most women. And those that aren't anxious are angry. And that's where I was. I was one ticked off chick. I couldn't believe this was happening to me after I had done so much homework. Again, it's important to be mindful of the fact that 50% of women experience pelvic organ prolapse. This isn't just a few women. This is half the female population, and they're women that are from teens through end of life. So one day I decided, because when women come into our patient support forum, we've got APOPS as a closed patient support forum that includes, again, women teens through end of life, 183 countries. And they come in because we're a closed space. They could talk quietly, privately, in front of other women about what they're experiencing. And when they come in, they typically either just read the posts in there, tire kick a little bit. They may post their own story. They may post a question. And no matter what they do, if they're posting anything, they're going to get a response from other members of our space. This particular day, because women typically post not just a paragraph, it's paragraphs of their information, I asked them to tell me in just one word how pelvic organ prolapse made them feel. And they came out of the woodwork. It took me quite a while to separate out the duplicate words in there. And you can look at any of these words in this paragraph and see how impacted women are, how their self-esteem is devastated by this condition. Defective, broken, weird, handicapped, sloppy, damaged, freaky, disgusting, pretty much says it all. Self-esteem is ripped away from them completely when they have pelvic organ prolapse, because this, again, is the most intimate aspect of their body. How can they not be devastated? So my question is always, why aren't women routinely screened for POP? It just doesn't make any sense. I would love the AUA community to recognize the power that you hold in your hands. This is such a large community of urologists. And there are certainly female pelvic medicine reconstructive surgeon urologists in your space who are the subspecialists who are the best at treating POP. But we need a much better backdrop on the diagnostic side. And women are often referred to urologists from their PCPs or from their gynecologists when women have got incontinence issues and the primary care does not know how to address it. Gynecology may have tried a couple of tools, but they weren't really successful. And again, urology comes into the picture at this point. When urologists have referrals of patients that have got incontinence, it's really, really important that they screen these women for pelvic organ prolapse, because very often that is a source of the incontinence. You're moving that bladder out of its normal position. You're putting pressure on that bladder by other organs. It's a no-brainer. Consider evaluating the cause of the incontinence, not treating the symptoms of the incontinence. Every voice matters. I say that and I mean it from the bottom of my heart. No matter which sector of healthcare you practice in, it doesn't matter if you're a practitioner or a patient or your advocacy, we all need to walk side by side and share information with each other to evolve the big picture. Nearly 4,000 years of medical documentation, inadequate screening speaks for itself. I implore the urologists in this space to take the gauntlet and run with it. Thank you so much for your time and consideration.